Okay, my presentation is on adverse child experiences, otherwise known as ACEs. ACEs cover many different topics like neglect, physical, emotional, and sexual abuse, including racism, household dysfunction, and teen dating violence. Today, I'll be going over adverse childhood experiences and how they impact mental development growing up, as well as some data that help show the impact of childhood violence and what we can try to do to shorten the number of children with adverse childhood experiences. According to childwelfare.org, ACEs are traumatic events that occur before a child reaches the age of 18. ACEs include all types of abuse and neglect, such as parental substance use, incarceration, and domestic violence. ACEs can also include situations that may cause trauma for a child, such as having a parent with mental illness or being part of a family that goes through divorce. ACEs will really damage a child's life, and as that person grows up, it'll continue to damage healthy brain development. As a child, the symptoms of possible ACEs are withdrawal from interest in activities, changes in behavior such as random aggression, hostility, rebellious or defiant behavior, nightmares, or sleeping problems. If you experience ACE, then it may also mean that as you develop older, you have a higher chance of getting chronic illnesses, mental health issues, or substance abuse problems. According to the CDC, toxic stress from ACEs can change brain development and how a body responds to stress. ACEs are a really serious and prevalent issue in public health. Also shown by the CDC, at least 5 of the top 10 leading causes of death are associated with ACEs. According to the National Conference of State Legislators website, the Center for Disease Control and Prevention, otherwise known as the CDC, and Kaiser Permanente conducted the first ACE study from 1995 to 1997 that asked more than 1,700 adults about childhood experiences, including emotional, physical, and sexual abuse, neglect, household challenges of parental separation, substance abuse, incarceration, violence, and mental illness. Nearly two-thirds of participants noted at least one ACE, and more than 1 in 5 noted 3 or more. This is an outrageous number, and it's very surprising and shockingly high. It makes me sad to think that 2 out of 30 people could tell you about some type of trauma they endured as a child. Nationally, since 2018, 37 out of the 52 states have state enacted ACE prevention legislation. This is important because of the high national average for ACEs and the mortality rate that comes along with it. According to childtrends.org, just under half, 45% of children in the United States have experienced at least one ACE, which is similar to the rate of exposure found in a 2011 to 2012 survey. It is also important to mention that later in the article, they list the top states reported for ACEs. In 5 states, Arizona, Arkansas, Montana, New Mexico, and Ohio, as many as 1 in 7 children have experienced 3 or more ACEs. In Washington State, reported according to the 2018 ACE report for Washington State at duh.wa.gov. In 2011, 26% of Washington adults reported having 3 or more adverse childhood experiences. Nationally, Washington State isn't that far above the national average and primarily consistent with national data. Another shockingly large statistic is the effects of ACEs around lower economic status, race, and gender. It's important to mention that ACE data widely ranges in these categories. In Washington State, according to duh.wa.gov, females, American Indian and Alaska Natives, young adults from 18 to 34 years old, and people with low incomes or less education were more likely to report having 3 or more ACEs within their lifetime compared to other Washingtonians. Nationally, the highest form of ACE is economic hardship, which puts parents in a more stressful environment that can impact their children. Later in the article, they go on to state that economic hardship affects these children because it can cause high parental stress and increase the likelihood of kids experiencing abuse or neglect. Efforts to strengthen families' economic security may help reduce parental stress, establish greater household stability, and protect children. Further, when taking statistics of ACEs from POC populations, according to childhoodtrends.org, it is so important to point out that children of different races and ethnicities do not experience ACEs equally. Nationally, 61% of Black non-Hispanic children and 51% of Hispanic children have experienced at least one ACE, compared with the 40% of white non-Hispanic children and only 23% of non-Hispanic Asian children. In every region, the prevalence of ACE is lowest among Asian non-Hispanic children, and in most regions is highest among Black non-Hispanic children. This is such a large deviation of numbers from white children or non-Hispanic Asian children, as well as children with higher economic standing. Socially, we will find higher ACE data in places of lower economic standing or of children of color because of the low social regard in society to care for these people and to think of them first in the first place. There's no doubt that the big economic gap and racism in the United States is one of the most deadly problems and clearly affects people of all ages starting at birth. So, how do we help reduce the amount of ACEs in the United States? To do this, it all starts with the education of ACE data and prevention, helping the general population understand what ACEs are and how we can try to avoid them. Adverse child experiences, like in the name, happen in childhood, which means there wasn't anything the child could do to help prevent this from happening. The responsibility is on the adults present in the child's life to make sure there's no trauma or harm done. To help reduce this, we can help educate new and old parents, communities, and policymakers to put orders in place to protect children. Some recommendations that I think could help prevent ACEs is to go to a parenting class so you can know how to best support your child. As quoted in the CDC with risk prevention website, ACEs don't have a single cause, and they can take several different forms. Many factors contribute to ACEs, including personality traits and experiences, parents, and the family environment and the community itself. To prevent ACEs and protect children from neglect, abuse, and violence, it's essential to address each of these factors. As a parent, you can help by enforcing social norms for safety against physical and emotional violence. You can also help your child by connecting them to caring adults, such as youth programs, mentoring programs, or daycare, even normal things such as making sure your child attends school regularly and helping them build a healthy social environment that they feel safe going to can really help prevent ACEs. Overall, ACEs are extremely important to prevent and pay attention to. You never know who may be struggling at home, and providing resources for everyone is so, so essential. Thank you so much for listening, and I hope you found this educational. Here is my resource page. Thank you.